And since the X-ray was the one that showed apoptotic changes, we used that for future experiments to test the activity of the herbal extract. And here again, the overall damage severity score was enhanced at the higher the dose, so dose-dependent suppression of the radiation-induced damage. And here we see that the light microscopy doesn't show the damage on apoptosis, but at least it shows the damage itself. And we saw that the dose of 10 milliliters per kilogram was most effective in alleviating all the degenerative changes. We have seen this again in the morning, and I'll just repeat it very quickly now. The markers for mucosal damage. These are the three typical ones. And we see here the different doses of radiation affect LDH. Again, dose dependency on the radiation dose. And again, the high herbal preparation has a dose-dependent effect against that rise. The same for diaminoxylase. And for TNF-alpha, which is one of the cytokines indicative of inflammation. For apoptotic markers, we again took several parameters. The cytosolic calcium was increased by different doses exposure, different doses of exposure, and different doses of S75 normalized the calcium. Mitochondrial cytochrome C, again another parameter for apoptosis, was again affected by the radiation, and BCL2 mitochondria, complex 1. So the four parameters of apoptosis were again normalized by our preparation. Oxidative stress, again the same thing. Reduced glutathione was again normalized or attempted to be normalized by the herbal preparation, and MDA as well. So, in conclusion, one can say that there is a dose-dependent effect of S75 in normalizing the histological changes induced by gamma radiation, and this could give us one more therapeutic advantage, and perhaps another indication for the use of the drug in patients undergoing radiotherapy, because this would perhaps tend to reduce the intestinal damage. However, as we said here, the dose we have used here of 10 milliliter is very high, but it was only given for 3 days before and 2 days after radiation. So we were intending to ascertain the effectiveness by giving it in lower doses, but for a longer time, maybe we can achieve the same result. This is in fact what we have concluded over the time, and this is what we are doing at the moment, giving a smaller dose, but for a longer time, to be within the therapeutic range of the drug. And again, the same picture as today in the morning. Thank you for your attention.
Thank you, Professor Mohamed, for excellent presentation.
Thank you.
It's my pleasure to give him the professor certificate.
Oh, I'm very proud of it. Thank you. Thank you.